Think about when you get a medical diagnosis. So much of it hinges on tests done in a lab, right? It's kind of an invisible world, but the accuracy there, well, it can literally change your life.
Absolutely. That tiny vial of blood or whatever sample it is goes on quite a journey. And keeping everything precise, from start to finish is just vital.
Totally.
That's really where these laboratory quality standards come into play.
Okay, laboratory quality standards, it might sound a bit dry.
Yeah, maybe a little.
But think about this. Whether you're a doctor relying on these results for critical decisions, or maybe you're just curious about how healthcare actually works.
Or maybe you've had a bad experience yourself.
Exactly. Or maybe you've had an experience with a test that went wrong. Understanding these standards kind of pulls back the curtain on a really crucial part of the system.
It does. The quality of lab work touches everyone, really everyone who interacts with healthcare.
Yeah.
And to really get under the skin of this, we've looked at, a range of sources. We've got guidelines from Joint Commission International, JCI, insights from the National Accreditation Board for Hospitals and Healthcare Providers, NABH.
Okay.
The World Health Organization's perspective, of course. Information from EQAS, that's the International Society for Quality in Healthcare.
Got it.
Then there's the practical expertise from places like Suprematic Consultancy and even real-world stories shared on the Labline show.
So for this deep dive, our mission is basically to pull out the most important stuff about these lab quality standards. We want to understand why they're needed, how they're used day to day, and ultimately how they impact the care you receive.
Yeah.
We're aiming for clarity and, those aha moments that make complex things click.
Let's lay the foundation then. When we talk about quality in a medical lab, what are we really aiming for? What does that actually mean?
Well, from what we've seen, it really boils down to a few key things. Getting it right, getting it on time, and getting it right consistently. First, accuracy. The result just has to be correct. If they're measuring your glucose, they need the real number.
Absolutely critical.
Then, timeliness. Those results need to get back to the doctors when they need them, to make informed decisions. Quickly, often.
Right. Speed matters. Reliability too, though. You need to trust that the test will give you the correct result every time it's run.
And that last one ties into reproducibility, doesn't it?
Mm.
If they ran that same sample again, would they get the same answer? They have to.
Those are definitely the cornerstones. And it's important to realize that achieving that quality isn't just about the moment the test is actually performed, what we call the analytical phase.
Right. Not just the machine running.
No. There are crucial steps that happen before and after. Think about the pre-analytical phase. This is everything from when your doctor orders the test, how the sample is collected.
Like, did they use the right tube?
Exactly. Was it the right type of collection tube? Did you fast if you were supposed to? All that stuff. Right through to how it's labeled and transported to the lab.
Oh, yeah, labeling.
Something as simple as a mislabeled tube.
Yeah.
Well, the consequences can be incredibly serious.
Absolutely. And then you get to the analytical phase, the actual testing in the lab.
Mm-hmm.
This is where they need to make sure the machines are calibrated correctly, the chemicals they're using, the reagents, right, that they're still good.
Not expired, stored properly.
And that everyone is following the exact procedures, like step by step. This is where those instrument errors you sometimes hear about could pop up.
Yeah, calibration drift, things like that. And then comes the post-analytical phase. This is all about reporting the results clearly.
Making sense of them.
Right. Interpreting them correctly are the reference ranges, the normal values appropriate for your age and sex, for example, and getting that information to your doctor quickly and accurately.
So even if the test itself was perfect.
Exactly. Even then, delays in reporting or a simple typo when someone's entering the result manually can cause huge problems. It's like a chain,
Right.
If one link is weak, the whole process is affected.
That's a good analogy. So, okay, we have a picture of what lab quality looks like. But why is it so important to always be looking for ways to improve it? You'd hope that labs are already operating at a high standard, right?
Well, yes, and many are incredibly dedicated. But consider this. Lab results are the bedrock, really, of an enormous number of clinical decisions.
How many are we talking?
Some estimates suggest it's like 70 to 80%.
Wow, 70 to 80% of diagnoses and treatment plans rely on lab results.
That's the figure often quoted. It's a huge influence. So when the quality isn't quite up to par, the ripple effects can be, well, significant.
We're talking about the potential for misdiagnosis, maybe doctors prescribing the wrong treatments, things that directly put patients at risk.
Exactly. That's the big one. And it's not just about patient safety, although that's obviously the primary concern. Poor quality also leads to a lot of wasted resources.
Oh, so.
Think about having to repeat tests because the first sample was unusable, maybe it clotted or something.
Right, redraws.
Or patients staying in the hospital longer than needed because of delayed or incorrect results. Or even unnecessary, potentially harmful treatments being given based on flawed data.
Okay, so it's safety and efficiency.
Precisely. And quality improvement efforts, they tend to target these really common issues. For instance, a blood sample might become hemolyzed. That's when red blood cells break open.
And release stuff that messes up the test.
Exactly. It can interfere with certain test results, or maybe the wrong type of collection tube was used, the wrong additive, which can also make a test invalid. Calibration errors on the lab instruments, delays in getting critical test results back to the doctor who ordered them. These are all areas where focused improvements can make a real, tangible difference.
It sounds like it has to be an ongoing commitment then, not a one-off fix.
It really does.
And it's interesting that the groups that accredit labs, like NABL, that's the National Accreditation Board for Testing and Calibration Laboratories here in India, and also big international ones like CAP, the College of American Pathologists, and the standard ISO 15189, they actually require this continuous improvement.
That's right. It's not just a suggestion. It's built into the rules. It's mandatory.
So it's part of being accredited.
Precisely. These accreditation bodies set the bar, and they expect labs to be actively looking for ways to make their processes better, safer, and ultimately improve patient outcomes. This often involves closely watching certain key indicators.
Key performance indicators, or KPIs. Right?
Yep, KPIs.
What kind of things are these quality-focused labs tracking day to day?
Oh, several important ones. The sample rejection rate is a biggie.
Meaning?
What percentage of the samples that arrive at the lab just can't be used for testing? Maybe they were collected wrong, labeled wrong, damaged in transit.
Okay. What's a good rate?
A well-run lab might aim for a rejection rate of less than, say, 1 or 2%. Very low.
Gotcha. What else?
Then there's turnaround time, or T8T. That's the time from when the sample is collected or maybe received by the lab to when the final report is ready.
And that varies depending on the test, I assume.
Absolutely. Labs often set specific TAT targets for different types of tests, especially those needed urgently, the STAT tests.
That makes sense. You need those critical results in the doctor's hands as fast as possible, especially in the ER or ICU.
Exactly right. Internal and external quality control pass rates are also vital. IQC and EQC.
Let's break those down.
Internal controls are like practice tests run within the lab every day, often with every batch of patient samples, to make sure the instruments and methods are working correctly right then.
Okay. And external?
External quality assessment or proficiency testing involves an outside agency sending identical, unknown samples to many different labs. Everyone tests them and sends the results back.
Ah, so you can compare yourself to other labs.
Exactly. It's a check on your overall accuracy compared to your peers. Then you have delta checks. Think of these as a safety net.
How do they work?
The lab's computer system flags significant changes in a patient's results compared to their previous tests on record. A big, unexpected jump or drop.
So it might catch an error.
Yeah.
Or a real change in the patient.
Both. It could indicate a problem with the current test, a mislabeled sample maybe, or it could be a genuine, clinically significant change in the patient that needs attention. It prompts investigation.
Clever.
What else? Critical value notification compliance. This tracks how reliably and quickly the lab communicates dangerously high or low results, critical values, directly to the clinical team.
Because just getting the result isn't enough if it's urgent.
Precisely. Someone needs to act on it fast. And finally, labs will look at trends in any issues, they call them non-conformances, that are found during their accreditation audits or internal checks to identify areas that need systemic improvement.
So these aren't just abstract numbers on a spreadsheet. They actually point to real issues and drive improvements.
They absolutely should.
Can you give us a concrete example, maybe from that lab lines show you mentioned?
Yep.
How monitoring one of these led to a positive change?
Certainly. Yeah, lab lines discuss a situation where a lab noticed they had a high rejection rate specifically for complete blood count tests, CBCs.
Okay, a very common test.
Very common. When they dug into the data, they found the main reason was improper mixing of the blood with the anticoagulant in the collection tube right after drawing the blood.
So the sample was Clotting or partially clotting?
Exactly, rendering it useless for a CBC.
Yeah.
Because they were tracking this rejection rate KPI, they were able to pinpoint the specific problem.
So what did they do?
They launched a quality improvement project. It involved going back and retraining the phlebotomists, the people drawing the blood on the correct collection and mixing procedures. And they updated the SOPs, the step-by-step guides they use.
And did it work?
It did.
Yeah.
The result was a significant, I think it was a 60% decrease in the rejection rate for CBCs within just 3 months.
Wow, 60%. That's a powerful example of how paying attention to the data leads to real-world impact. Less hassle for patients needing redraws, faster results.
Better care. Are there other examples of these kinds of quality improvement projects in action?
Yes, absolutely. Reducing turnaround time is a really frequent focus, for obvious reasons.
Right.
In a biochemistry lab, for example, they might do a workflow mapping exercise. Literally follow the sample's journey, step by step.
Identify the bottlenecks.
Precisely. Where are samples sitting around waiting for the next step? By implementing what's called real-time processing, basically moving samples through the system as soon as they arrive, minimizing batching, and by setting up clever auto-verification rules in their laboratory information system.
The LIS, the lab's software brain.
Right. They saw a dramatic drop in TAT for urgent or STAT tests. One example showed a drop from 90 minutes down to just 45 minutes.
Wow. In critical care situations, that hour and a half down to 45 minutes,
Yeah.
that can be literally life-saving.
It really can. And you mentioned auto-verification.
Yeah, that's where the computer system automatically validates and releases results that fall within certain predefined criteria, like they're within the normal range and the internal QC passed and there's no delta check flag.
So lab scientists don't have to manually check every single normal result.
Exactly. It frees up their time and expertise to focus on the abnormal results, the complex cases, the potential problems.
Cutting the turnaround time in half, that's a huge difference. What about those errors in identifying samples? Mislabeling? That seems like a really fundamental risk.
It is. It's one of the most critical areas. Another impactful project involved I think it was a 500-bed hospital, implementing a comprehensive barcode-based system for tracking every single sample.
From bedside to testing.
Right. When a sample is collected from a patient, it gets a unique barcode label printed right there. And that barcode is scanned at every single handover point, leaving the ward, arriving at the lab, being put on the analyzer.
It's traceability.
Total traceability. This seemingly simple change, well, simple in concept, maybe complex to implement,
Sure.
led to a remarkable 95% reduction in lost or mislabeled samples.
95%, that's incredible. Just by using barcodes consistently.
It significantly boosts patient safety, reduces the chance of getting someone else's result, which is a nightmare scenario.
Absolutely. And we also heard about the importance of getting those critical results to doctors quickly. How do labs make sure that happens reliably, that the message actually gets through?
Good question. One lab implemented a multi-pronged system. It automatically sends SMS text alerts to the responsible clinicians when a critical value is detected by the LIS.
Okay, a text alert.
And these values, things like a dangerously high potassium level or a very abnormal blood clotting test result, an INR, they also appeared prominently on a central electronic dashboard that required the clinician to actively acknowledge they had seen the result. Click a button, basically.
Ah, so there's proof they saw it. Closing the loop.
Exactly. By making that acknowledgement mandatory, they saw a massive increase in compliance. I think the figure was from only about 40% of critical results being formally acknowledged before the system, up to 96% after it was implemented.
Huge improvement. These examples really drive home how these quality initiatives aren't just about ticking boxes or paperwork. They have a direct, meaningful impact on patient care and also the efficiency of the lab itself. But surely, putting these improvements in place isn't always easy. What are some of the common hurdles that labs face when they try to do this?
You're right. Implementing quality improvement, or QI, in labs often comes with significant challenges. One very common one is just staff resistance to change.
People like doing things the way they've always done them.
It's human nature, isn't it? Introducing new procedures, new software, new ways of working can be met with, well, some reluctance or skepticism.
Yeah.
Then there's the challenge of getting access to good data and being able to analyze it effectively, ideally in real time, to even understand where the problems are occurring in the first place. You can't fix what you can't measure.
Right. Data visibility.
Budget limitations are almost always a factor, too. Investing in new technology, upgrading the LIS, maybe hiring a dedicated quality manager that all costs money.
True.
In some settings, particularly maybe smaller labs or in lower resource areas, manual processes and paper-based reporting are still common. And unfortunately, that just introduces many more opportunities for errors, transcription mistakes, lost paper.
Makes tracking things harder, too.
Much harder. And sometimes, even within the same lab, different sections might have slightly different ways of doing the same thing. A lack of fully standardized operating procedures, SOPs, can make it really difficult to implement consistent improvements across the board.
So for a smaller lab, maybe one that's listening to this and thinking, wow, this sounds overwhelming, where should they even start their quality improvement journey?
That's a great question. The key, really, is to start small and focus. Don't try to boil the ocean.
Okay.
Pick just one or two indicators, KPIs that seem to be the most critical for patient safety in your setting, or perhaps are showing the biggest obvious problems, like a high rejection rate for a specific test.
So focus your effort.
Yes. And get everyone on the lab team involved right from the beginning. Their frontline experience is invaluable. They often know where the real problems lie and might have great ideas for solutions.
With sense. Tap into their knowledge.
Absolutely. Carefully document the issues you're seeing. Gather some baseline data. Then make small step-by-step changes. Test them out using simple, practical tools.
Like what kind of tools?
Oh, things like a fishbone diagram, Ishikawa diagram that can help you brainstorm all the potential root causes of a problem.
Okay.
The PDSA cycle plan Do, Study, Act is a fantastic framework for testing a change on a small scale before you roll it out widely. Plan the change, try it out, study the results, and then act based on what you learned.
Plan, do, study, act, PDSA.
Got it. And simple run charts can help you visualize your data over time to see if the changes you're making are actually leading to improvement. Is that rejection rate trending down? Is the TIT getting shorter?
See the impact visually.
Yeah. And as the folks on lab lines really emphasize, don't underestimate the importance of simply listening. Listening to your staff and listening to your clients, the doctors, the nurses, the wards who rely on your lab results. What are their pain points?
That makes it feel much more manageable. Start small, involve the team, use simple tools, and listen to feedback.
Exactly. It's an iterative process.
Let's maybe step back and look at the bigger picture again.
Yeah.
We've talked about individual labs and their QI efforts. But how do these quality standards play out on say, a global scale? Are there international bodies driving this?
Oh, very much so. That's an important perspective. Joint Commission International, or JCI, is a major global player. They're really focused on healthcare quality and patient safety worldwide.
JCI, yes.
Their mission is basically to help healthcare organizations across the globe achieve and maintain the highest standards of care. They work with, I think it's over 1,000 accredited and certified programs now in more than 70 countries.
So they're setting a kind of international benchmark for quality in hospitals and labs.
That's a good way to put it, yes. An international benchmark.
What are some of the benefits that hospitals and other healthcare organizations actually see from going through the JCI accreditation process? It sounds like a lot of work.
It is a lot of work, but the benefits are significant. Healthcare leaders who've pursued JCI accreditation often report things like better teamwork and communication between different departments.
Because everyone has to work together for it.
Exactly. The rigorous preparation process really forces collaboration. It provides fantastic learning opportunities for their staff, as they have, to learn and implement international best practices.
Okay.
It can also give them a competitive edge, certainly boosts the community's confidence in the safety and quality of the care they provide. People look for that JCI seal.
Right, it's a mark of quality.
It is. Furthermore, it helps improve their risk management practices and really fosters a stronger overall culture of patient safety throughout the organization.
It sounds like a really comprehensive validation of their systems. Now, closer to home for many of our listeners, we mentioned NABH earlier.
Yes, the National Accreditation Board for Hospitals and Healthcare Providers, NABH. It's a constituent board of the Quality Council of India.
And their focus is India specifically.
Primarily, yes. Their focus is on establishing and operating accreditation programs specifically tailored for hospitals and healthcare providers within India, taking into account the unique context, regulations, and needs of the Indian healthcare system.
Got it. And we also came across Supremedic Consultancy in our research. What role do they play in this landscape?
Supremedic is an example of a consulting firm that specializes in helping hospitals navigate the often complex and demanding process of achieving accreditation. particularly NABH accreditation for hospitals and NABL for labs.
So they guide hospitals through it.
Exactly. They offer a wide range of support, everything from the initial planning and design stages of a hospital right through to implementing and maintaining the robust quality management systems needed to meet those stringent accreditation standards.
So they're like experienced guides helping hospitals reach these important quality milestones.
Right.
Makes sense. Now, ISQA, that's the International Society for Quality in Healthcare. What's their main focus? They sound global, too.
They are global. ISQA is a global not-for-profit organization. They're really dedicated to promoting and improving quality and safety in healthcare worldwide, but maybe in a slightly different way than JCI.
How so?
They do it through a variety of means, providing education and training programs, facilitating the sharing of knowledge and best practices across borders.
Yeah.
They run major international conferences.
Okay, knowledge sharing.
Yeah, and they also offer external evaluation and recognition services for healthcare organizations and even for other accreditation bodies that are committed to quality improvement. They essentially connect this global network of healthcare professionals, researchers, policymakers from over 70 countries who are all passionate about enhancing quality and safety.
It sounds like a global community of practice, really, all dedicated to healthcare quality.
That's a very good description.
And finally, the big one.
Yeah.
What's the World Health Organization's perspective on laboratory quality standards, the WHO?
Well, the WHO views strong laboratory quality standards as absolutely essential, foundational, really, for producing accurate and reliable test results. And those reliable results, in turn, are fundamental for building confidence in testing services and for enabling doctors to make the right informed decisions about patient management and treatment.
Okay.
The WHO also recognizes that implementing very detailed and comprehensive standards, like the full ISO 15189 standard for medical labs, can be particularly challenging, especially in resource-limited settings.
Right. Not every lab has the same resources.
Not at all. Therefore, they strongly advocate for a practical, step-by-step, tiered approach to implementation. They encourage countries to draw on the core principles of ISO standards, but to adapt and simplify them to be more accessible and achievable based on local context.
So making quality improvement feasible everywhere.
Exactly. They've even developed specific guidelines, tools, and checklists like the Laboratory Quality Stepwise Implementation Tool, EQAS, to assist countries and individual labs at all levels of resource availability in establishing and progressively improving their laboratory quality systems.
So the WHO is focused on making quality standards achievable for everyone, while acknowledging the diverse challenges faced by different healthcare systems around the world. That's really important work.
It is crucial.
Now, let's dig a bit deeper into these standards themselves. What are the fundamental building blocks of a laboratory quality system? You mentioned policies, procedures.
Right. Quality standards essentially provide a blueprint, a framework for labs to meet regulatory requirements, yes, but more importantly, to consistently monitor and improve their own performance. Building a robust quality system usually follows a kind of logical hierarchy or progression.
Okay.
It typically starts right at the top with a quality policy. This is the lab's overarching commitment to quality. What are their main goals and principles related to quality? Signed off by top management.
Sets the tone.
Exactly. This is then translated into a more detailed quality plan, which outlines the specific actions, strategies, resources, and timelines the lab will use to implement that policy and achieve its quality objectives.
Getting practical.
Then you have the quality manual. This serves as a central reference document, kind of the constitution for the quality system. It brings together all the lab's policies, plans, outlines the structure of the documentation, and references the key procedures.
The main guidebook.
Pretty much. Below that, you have the procedures themselves. These are the detailed step-by-step instructions for carrying out specific processes or tasks consistently. These are often documented as standard operating procedures or SOPs.
SOPs, yeah.
Yeah.
Heard that acronym a lot.
Very common. SOPs for everything from receiving a sample to performing a specific test to reporting a result. And sometimes, for really complex tasks, you might have work instructions, which provide even finer-grained detail on how to perform particular activities within a larger procedure.
Super specific instructions.
Yes. And of course, none of this works without comprehensive staff training to ensure everyone understands the policies, knows how to find and follow the relevant SOPs, and is competent to perform their assigned tasks.
Training is key.
Absolutely essential. And finally, ongoing monitoring and evaluation are critical. Using those KPIs we talked about, conducting audits, gathering feedback, all to assess how well the quality system is actually working in practice and to identify areas where further improvement is needed.
It sounds like creating a really solid, documented foundation for consistent and reliable work. What are some of the key steps a lab needs to take to actually put this quality system into practice? Build it from scratch or improve an existing one?
It really starts with strong, visible commitment from the top leadership, the lab director, the hospital management they need to champion the importance of quality, provide the necessary resources, and clearly communicate the lab's quality policy to everyone. Without that top-level buy-in, it's very difficult.
Lead from the front.
Absolutely. Then, as we said before, it's vital to involve all laboratory staff. Everyone has a role to play in maintaining and improving quality, and their input is crucial. Often, a gap analysis is performed early on. That involves systematically comparing the lab's current practices, procedures, and documentation against the requirements of the chosen quality standard, like ISO 15189 or NABH standards. It helps pinpoint the specific areas where changes or developments are needed. Where are the gaps?
Okay, identify what needs fixing.
Exactly. Initially, many labs focus on getting the core technical aspects right and building the necessary documentation. This includes developing and implementing those SOPs for everything: equipment use, test methods, sample handling, pre- and post-analytical phases.
Document everything.
Pretty much. Comprehensive training on the new standards and procedures is essential for all staff members, with records kept. Regular internal audits are conducted where trained staff from within the lab check compliance in different sections.
Checking themselves.
Yes, it's a self-check mechanism. And then you have external audits, usually by the accreditation body, to provide an independent assessment. Both are needed to identify any areas that need corrective action fixing problems that have already occurred, or preventive action stopping potential problems before they happen.
Proactive.
Yes. Management review, typically done at least once a year, provides a formal opportunity for the lab leadership to step back, look at all the data from audits, QC, KPIs, complaints, etc., and assess the overall effectiveness and suitability of the quality system. Are we meeting our goals? What needs to change?
Strategic overview.
Exactly. And underpinning the entire process, the engine driving it forward, is the principle of continuous quality improvement, or CQI, that ongoing commitment to systematically making things better based on data and feedback.
So it's a continuous cycle. Plan, do, check, act. The PDSA cycle we mentioned earlier, but applied to the whole system. Planning improvements, implementing them, checking if they work through audits and monitoring, and then acting on those findings to standardize the improvement or plan the next cycle.
That's a perfect summary of the CQI philosophy.
Now, the WHO guidelines you mentioned, they break down the development of laboratory quality standards into 11 key areas, or quality system essentials. Can you give us a quick run-through of what those encompass? It sounds comprehensive.
Yes, the WHO provides a very useful and comprehensive framework, particularly helpful for labs starting out or in resource-limited settings. Let's list them quickly.
Okay.
1. Organization and management looks at the lab's structure, leadership roles, responsibilities. 2. The quality management system itself: policies, plans, manual, documentation control. 3. Human resources or personnel staffing, qualifications, training, competency assessment.
People are key.
Absolutely. 4, accommodation and environmental conditions, the physical space, safety features, utilities like power and water. 5, laboratory safety, biosafety, chemical safety, waste management, PPE.
Critical.
6, laboratory equipment selection, calibration, maintenance, validation. 7, procurement and supplies management, ensuring quality reagents, consumables, inventory control, supplier evaluation. 8, information management, data handling, record keeping, confidentiality, LIS.
Managing the data flow.
9, managing laboratory specimens, the entire process, from collection, transport, handling, storage, to disposal. 10, customer service and resolution of complaints, understanding user needs, communication, handling feedback.
The user focus.
And finally, 11, outbreak alert and laboratory network, the lab's role in public health surveillance, reporting, and response coordination.
Wow, that covers pretty much everything that happens in and around a lab, doesn't it?
It's designed to be holistic, yes, covering all the critical components that contribute to quality results and safe operation.
That's a really wide range of factors. Can you give us maybe just a few specific examples of what meeting these standards might look like in a real lab? Make it a bit more tangible.
Sure, let's take a few. Under the quality management system, Area 2, a lab would be required to have a documented, controlled quality manual that everyone can access and is familiar with. For laboratory equipment, Area 6, they would need documented procedures and records showing they perform both internal quality control checks every time they run tests and participate regularly in external quality assessment or proficiency testing programs.
Checking themselves and being checked by others.
Right. Under human resources, Area 3, they'd need documented training plans and records for all new staff, plus evidence of regular competency assessments for everyone to ensure they are still performing their duties correctly over time.
Proving people know their jobs.
Yep. Information management, Area 8, would require having defined, documented policies for how long different types of records and specimens must be kept, complying with national regulation.
Like a retention rules.
Exactly. Managing laboratory specimens, Area 9, includes having clear, detailed, and readily available SOPs for the correct labeling of all patient samples at the point of collection.
Getting that label right first time.
Crucial. Customer service, Area 10, might involve conducting regular surveys to get feedback from doctors and nurses about the lab services and using that feedback to make improvements.
Asking the users.
And for outbreak alert, Area 11, a lab, especially a public health lab, would need to have established communication pathways and protocols for reporting specific notifiable diseases immediately to the designated national public health authorities.
Those examples really help to bring those 11 areas to life. Now, looking towards the future, what do you see as the next big developments in laboratory quality and lab medicine generally? Technology must be playing an ever-increasing role.
Oh, absolutely. Technology is a massive driver. We're seeing some very exciting trends emerging that will likely reshape lab quality.
Like what?
Artificial intelligence, AI, is being explored quite actively. For instance, for things like predictive quality control.
Predictive QC.
Yeah, where sophisticated algorithms can analyze vast amounts of instrument data, temperatures, pressures, reagent levels, internal checks to identify subtle shifts or patterns that might predict a potential problem before it actually leads to inaccurate patient results, catching issues earlier than traditional QC might.
Wow, proactive AI monitoring.
Exactly. We're also seeing a continued move towards fully integrated laboratory information systems, LIS, and hospital information systems, HIS, seamless data flow between the lab and the rest of the hospital.
Benefits.
Better communication, reduced need for manual data entry, which minimizes transcription errors, faster access to results for clinicians integrated into the patient's electronic record.
More efficient and safer.
Definitely. Automated robotics for the pre-analytical phase, that front-end part where samples arrive, is another big area. Things like automated sample sorting, aliquoting, capping, decapping.
Taking the human handling variable out of it.
Reducing it significantly, yes. Helping to improve consistency, speed, and reduce potential errors right at the beginning of the testing process.
Makes sense.
There's also a growing trend towards more patient-driven lab testing and greater transparency, patients having more direct access to their results, maybe through portals, understanding them better.
Empowering patients.
Yes. And finally, the development and use of real-time quality dashboards. These give lab managers and even bench technologists immediate visual access to key performance indicators, TATs, QC failures, rejection rates, allowing for much quicker identification and resolution of any emerging issues.
Seeing problems as they happen.
Exactly. Not waiting for a monthly report.
It sounds like the lab's becoming even more connected, data-driven, and proactive. And technology is clearly a key driver of that evolution. It's also interesting how you mentioned labs are increasingly seeing themselves as crucial advocates for patient safety, not just test producers.
That's a fundamental shift in mindset that's really taking hold. It's not just about technical accuracy anymore. It's about the lab's role in the entire patient journey and ensuring safety at every step they influence.
Right. Now, within those 11 key WHO areas we discussed, some really deserve a closer look because they touch on so many potential failure points. Managing laboratory specimens, for example, Area 9, seems incredibly critical.
It is so incredibly critical. So much can go wrong.
Yes, we touched on it earlier, but let's really maybe delve into the crucial aspects of handling specimens properly across those three phases again. Pre-analytical, analytical, and post-analytical. What are the absolute must-dos?
Okay. Starting with the pre-analytical phase, before the lab even touches the sample. It all begins with the test request itself. That request form, whether paper or electronic, needs to have complete and accurate patient identification, clearly indicate which tests are needed, and ideally include relevant clinical details that can help the lab interpret the results in context.
Garbage in, garbage out applies to the request too.
Absolutely. Then, proper collection technique is vital. This includes using the correct venipuncture or sampling technique, providing crystal clear instructions to patients when they need to collect samples themselves, like urine or stool, and crucially, using the right types of collection containers with the appropriate additives or preservatives, like specific anticoagulants for blood tests, the right color top tube.
Getting the tube right matters.
Hugely. Different additives affect different tests. Accurate labeling of the sample container at the moment of collection, usually right at the patient's side, with at least 2 unique patient identifiers is absolutely non-negotiable. This prevents mix-ups.
Labeling right there and then.
Yes. And finally, safe and timely transport to the lab is essential to maintain the integrity of the sample. Some samples need to be kept cold, others at room temperature, some protected from light. For certain types of samples, especially potentially infectious materials being shipped longer distances, there are strict packaging regulations like the IATI guidelines that must be followed, often involving triple packaging systems for safety.
Triple packaging.
Yeah, a primary container, secondary leak-proof container, and sturdy outer packaging. And importantly, labs need clear written policies on when they must accept or reject a specimen if it's not suitable for testing, for example. If it's unlabeled, mislabeled, collected in the wrong tube, hemolyzed, insufficient quantity.
So they need rules for saying, no, we can't test this.
Yes, documented rejection criteria are essential for quality.
It really highlights how many opportunities there are for things to go wrong before the sample even reaches the testing equipment, doesn't it?
Exactly. So many variables in that pre-analytical phase. Moving into the analytical phase, when the testing actually happens, the focus shifts to having detailed, validated, and readily accessible standard operating procedures, SOPs, for every single test method the lab performs. Everyone doing it the same way.
Consistency again.
Always.
Yeah.
And a robust internal quality control IQC system is absolutely essential. Running controls with known values alongside patient samples to ensure the accuracy and reliability of each batch of tests.
What happens if the control fails?
If the QC results fall outside the predefined acceptable limits, the lab must have clear protocols in place. Stop testing patient samples. Identify the cause of the problem, could be the reagent, the instrument, the calibrator, correct it, rerun the QC successfully, and only then release any patient results from that run. You have to prove the system is working correctly first.
No results go out if the controls are bad.
That's the rule.
And then the final stage, the post-analytical phase. What are the key things to consider there for specimen management and results?
Right. After the test is done, trained and authorized personnel, usually senior technologists or scientists, need to carefully review and technically validate the results before they are officially released or reported.
A final check.
Yes. The reporting of results needs to be clear, unambiguous, using standardized units of measurement, like SI units where appropriate, and must include the appropriate reference intervals or normal ranges so that the doctor can easily interpret whether the result is high, low, or normal for that patient population.
Context is key for interpretation.
Absolutely. There must be well-defined, reliable procedures for promptly notifying clinicians about any critical results, those results that fall outside predefined panic levels, and indicate a potentially life-threatening situation for the patient. This notification needs to be direct and confirmed.
Not just hoping they see it in the system later.
No. Often requires a phone call or secure message with read receipt. And importantly, labs need documented procedures for the proper short-term and long-term storage of specimens after testing, and eventually for their safe disposal according to biosafety regulations. Retaining them for a specific period allows for potential retesting, add-on tests, or troubleshooting if needed.
Proper storage and disposal, that's also crucial from a safety and environmental perspective, isn't it?
Absolutely. Which leads us naturally to another vital component of those WHO essentials, laboratory safety itself. Area 5.
Right. Labs can be hazardous places.
They certainly can be. Laboratories inherently involve potential hazards, chemical reagents, some toxic, flammable, corrosive, biological samples that could be infectious, sharp objects like needles and glass slides, electrical equipment, ergonomic risks. The list goes on.
So safety has to be paramount.
It has to be ingrained in the culture. Establishing clear, comprehensive safety rules and ensuring that everyone consistently understands and follows them is paramount. This includes the mandatory and correct use of appropriate personal protective equipment, or PPE.
Gloves, Codes, eye protection.
Exactly. Depending on the specific task and risks involved, there need to be detailed SOPs, not just for tests, but also for the safe handling of all equipment and specimens, as well as specific procedures in place for managing spills, leaks, fires, and other types of accidents or emergencies. Emergency preparedness.
Knowing what to do when things go wrong.
Yes. And it's fundamentally the employer's responsibility to ensure the protection of their staff. This can include providing necessary vaccinations, like the hepatitis B vaccine, which is crucial for anyone handling blood, and having clear, confidential protocols for post-exposure prophylaxis, PEP, in case of incidents like needle stick injuries involving potentially infectious material.
So lab safety isn't just a set of guidelines on a shelf. It's a fundamental requirement for protecting the people who work there, preventing accidents, and ensuring the integrity of the work, too.
Well said. It's integral to quality.
And alongside safe practices, you obviously need the right tools for the job, which brings us to the significance of equipment and supplies, areas 6 and 7.
Yes, reliable and appropriate equipment is the very foundation of any clinical laboratory. You can have the best staff and procedures, but if the analyzer isn't working right,
You won't get accurate results.
Exactly. This starts right back at the beginning with a well-thought-out procurement process for new equipment. It shouldn't just be about the initial cost. Labs need to consider the long-term reliability of the equipment, its maintenance requirements, the availability and cost of servicing and spare parts in their region, and the quality of technical support from the vendor.
Thinking long-term.
Yes. Ideally, labs should have service contracts in place for major pieces of analytical equipment to ensure regular preventative maintenance and prompt repairs when needed. And crucially, all staff members who will be using any piece of equipment must receive thorough training on its proper operation, routine maintenance they can do themselves, and basic troubleshooting with records kept of this training.
So everyone knows how to use it safely and correctly.
Right. Proper inventory management for reagents, calibrators, controls, and other essential supplies is also vital. This isn't just about having enough stock, it's about ensuring quality.
How?
It includes ensuring that all supplies are stored under the correct conditions, correct temperature, protected from light if necessary. Carefully monitoring expiration dates is critical. Expired reagents can lead to incorrect results. Using a first in, first out, or FIFO system for stock rotation helps minimize waste and ensures that older reagents are used before they expire.
FIFO used the oldest stuff first.
Simple, but effective. And the WHO also provides specific guidance on the acceptance and validation of donated equipment, which can be common in some settings, to ensure that it actually meets the required quality, safety, and usability standards for the lab before they start using it for patient testing. You don't want someone's cast off causing problems.
Good point. It sounds like a lot more thought goes into equipping and supplying a lab than just ordering some machines and chemicals off a list.
A well-managed lab puts a lot of effort into equipment and supply management.
And of course, all of this activity, the requests, the testing, the QC, the maintenance, generates a huge amount of data and information. How are labs managing and safeguarding all of that? Area 8, information management.
Yeah, information management is another critical pillar of a high-quality lab system. We're talking about everything from the initial test request forms, the raw data from the analyzers, the final patient reports, the records of all the quality control checks, equipment maintenance logs, staff training files, audit reports. It's a mountain of information.
Here's careful handling.
Extremely careful. All of these records, whether they are traditional paper forms or stored electronically in the LIS or other systems, need to be legible, accurate, easily retrievable when needed for clinical care, audits, or troubleshooting, and stored securely to protect patient confidentiality and comply with data privacy regulations like HIPAA or GDPR or local equivalents.
Security and accessibility.
And integrity. The records shouldn't be alterable after the fact without leaving an audit trail. There should also be clearly defined and documented retention times for different types of records, and also for stored patient samples, specifying exactly how long they need to be kept based on clinical need and legal or regulatory requirements. You can't keep everything forever, but you need to keep it long enough.
Right. What about communicating results?
That's part of information management, too. It's important for labs to agree on realistic turnaround times, TATs, with the clinicians and wards who are using their services, managing expectations. And as we've stressed, having specific, reliable, documented procedures for managing and promptly reporting those critical results is absolutely vital. Ensuring the information gets where it needs to go, when it needs to get there.
So it's not just about generating the data, it's about handling it responsibly, securely, and effectively throughout its entire life cycle, from creation to eventual archiving or disposal.
Exactly. Information is a key output of the lab, and it needs its own quality management.
Now, labs don't operate in a vacuum, do they? They have customers, primarily the doctors and nurses who order the tests and use the results, but ultimately the patients too. How does focusing on those customers fit into the concept of quality standards? Area 10.
Customer service, or maybe better term user focus, is an absolutely essential element of a quality lab operation. It's not enough just to be technically proficient.
Need to meet user needs.
Precisely. Labs should be proactive in offering guidance and advice to clinicians maybe on which tests are most appropriate for a patient's suspected condition, how to properly collect and handle specific sample types, and how to interpret complex or unusual lab results they receive. Being a knowledgeable partner.
Adding value beyond just the number.
Yes. Regular communication, perhaps through newsletters, user meetings, or direct consultations, can help the lab understand the evolving needs and challenges faced by their users and identify areas for improvement from the user's perspective. What isn't working well for them?
Okay.
Labs also need to have clear and efficient systems in place to inform their customers proactively about any significant issues, like unexpected delays in testing due to equipment downtime, or any changes to lab procedures or test menus that might affect them, keeping users informed.
Managing expectations again.
Yes. And crucially, there must be a formal, accessible mechanism for receiving, documenting, tracking, and effectively resolving any complaints or feedback received from users. This isn't about blame, it's about learning. Records of these complaints and the actions taken to address them should be regularly reviewed by management as part of the continuous quality improvement process.
Using complaints as a source of improvement ideas.
Definitely. They often highlight real problems.
So it's really a two-way relationship. The lab provides a vital service, and they need ongoing feedback from users to ensure they are consistently meeting the needs of those who rely on them. And that principle of continuous improvement just keeps coming up, doesn't it? It seems woven into everything.
It's absolutely central. As I said, quality isn't a static destination you arrive at. It's an ongoing journey, a culture. It requires that constant cycle of review, evaluation, and refinement of all procedures and processes within the lab.
Never finished improving.
Never finished. Those regular management reviews we mentioned, where the lab's leadership team systematically assesses the overall performance of the lab against its quality objectives, using all the data available: audits, QC, KPIs, proficiency testing, complaints. They are a vital engine for driving this continuous improvement cycle, identifying opportunities and making changes.
Finally, we briefly mentioned the lab's crucial role in public health. How do quality standards help prepare labs for challenging situations like disease outbreaks? That's Area 11.
Preparedness for outbreaks is a key responsibility, particularly for designated public health laboratories, and robust quality standards play a vital role here too. It's not just about routine testing.
How so?
This includes being an integral part of a coordinated national or regional laboratory network designed for disease surveillance and response. This means having clearly defined referral pathways for sending samples for specialized testing, using standardized case definitions and reporting systems for diseases of public health concern. Everyone speaking the same language, essentially.
Coordination is key.
Absolutely. During declared disease outbreaks, there are often specific, mandatory, and time-sensitive reporting requirements outlined in national policies or international regulations, like the WHO's International Health Regulations, IHR. Labs need systems in place to meet these.
Okay.
National laboratory networks need to actively work on capacity building, ensuring they have sufficient trained staff, validated methods, equipment, and supplies, especially having the necessary specialized reagents and rapid diagnostic tests readily available, perhaps pre-positioned at different strategic levels of the network, to handle a surge in demand during an outbreak.
Being ready for the surge.
Yes. And, importantly, ensuring safety during field sampling, when lab staff or other healthcare workers might be collecting specimens out in the community during an outbreak investigation, requires specific protocols, appropriate personal protective equipment, PPE, and training to safeguard both the healthcare workers and the public from potential exposure. Proper specimen collection, identification, and transport from the field are also critical under difficult conditions.
It's really reassuring to know that these quality standards extend beyond the routine day-to-day and cover these critical public health functions as well. It shows the breadth of their importance.
Absolutely. A quality lab is a cornerstone of both individual patient care and public health protection.
So as we bring this deep dive into laboratory quality standards to a close, It's just so clear that this is a profoundly important and actually incredibly complex area of healthcare.
It really is.
It involves this vast array of rigorous standards, an unwavering commitment to continuous improvement. That theme just came through so strongly, and the dedicated efforts of countless professionals working, often unseen, behind the scenes.
Exactly. And it's so important, I think, for everyone, patients, clinicians, policymakers, to understand that direct and powerful link between high-quality work happening in the laboratory and the accuracy of medical diagnoses, the effectiveness of the treatments we receive, and ultimately achieving better health outcomes for all of us. It's not just a technical function, it's integral to care.
It truly makes you think about how much we rely on these often unseen laboratory processes in our everyday interaction with healthcare, doesn't it? The next time you or someone you know have a blood test or any other kind of lab work done, maybe just take a moment to appreciate the immense effort, the systems, the checks and balances, and the robust quality assurance measures that are in place or should be in place to ensure the reliability and trustworthiness of those results.
Yeah.
It really is about maintaining trust and safety within our entire healthcare system. And maybe it even makes you consider how similar principles of standardization, continuous measurement, and quality improvement could be or should be applied in other complex systems we encounter in our daily lives outside of healthcare. Something to think about.
That's a fascinating thought. And if you'd like to delve even deeper into this specific area, we really encourage you to explore the resources we've mentioned throughout this discussion. Check out the websites of organizations like Joint Commission International, JCI, NABH here in India, the World Health Organization, WHO, and EQAS. Lots of valuable information out there.
Definitely worth exploring further. Well, thanks for joining us for this deep dive into the world of laboratory quality. Until our next exploration, keep your curiosity sharp.